as you come in the front door of our New Hampton location, the first thing you're going to see is our beautiful Optical. And as you turn to your right, you'll see our front desk. And if you're a patient coming in for an eye exam or if you're coming in for an eye emergency, this is where you would report to, and you'll see one of these 3 smiling faces behind that front desk. So say hi to Keziah, Brittany, and Jen. After you check in at the front desk, you're going to turn to your left and head on back to our waiting area, where in a short amount of time, you'll be greeted by one of our clinic techs. So meet Gloria, Jess, and Sammy. As you come out of the waiting area, you'll walk down this hallway into one of our 4 exam rooms, and this is where the pre-test process starts. When your pre-testing is finished and you're here for a routine eye exam, the next stop would be our special testing area, which you see the entrance to here. One of the first things we'll probably do is a refraction in this room, where we determine the prescription for your glasses or contact lenses. We also may do a wide-field retinal image to check for any signs of retinal pathology. And the other instruments in this room would be a corneal endothelial cell count, which you see to the left with the Conan instrument. We do this with our contact lens patients and also our patients with corneal disease. And then to the upper right, if you have dry eye problems and we want to determine how best to treat them, we would get data from this instrument. And in the lower right is our dark adaptation test to determine how quickly you can adapt from bright lights or headlights at night. Here's another special testing room that we do our visual field testing in. Our patients with glaucoma, macular degeneration, and diabetes will usually get one of these tests every year to monitor for any vision loss. And in another special testing room, we have our OCT, which is like an MRI of your retina and gives us valuable data in retinal disease. This is our ERG technology, or electroretinogram technology, that we've been using for the past couple of years. We used to send patients to a university setting to get this test, and the equipment filled up a whole room. But now we can do that with a handheld instrument, and it gives us valuable data on retinal function in our diabetic and macular degeneration patients. One of the leading causes of dry eye is meibomian gland dysfunction. And once we've diagnosed that, this is our latest treatment method for freeing up the oils in the meibomian glands of our eyelids. It's a 10-minute heat and massage treatment that feels great and helps restore that oil flow that we need to keep the tears from evaporating from our eyes. In this exam room, we have a slit lamp connected to a high-resolution video monitor so that we can show patients in detail the eye disease that they may have in the anterior segment or front sections of their eyes. Before we leave the clinic area, we'll show you some of the staff workspaces. This is the doctor's office where they have access to digital patient charts through a computer workstation. Meet Dr. Uglum and Dr. Eiler. This is a clinic tech workstation area, and you have already met Jess and Sammy. This is our clinic manager's workstation, and you've already met Gloria. Okay, as we exit the clinic area, we'll walk down this hallway. And the first space on the right is our contact lens area, where you will see 2 stations for insertion and removal training. And you'll also see part of our large contact lens trial inventory. We use these lenses in our contact lens screenings to be sure that they fit properly and that the patient sees the way they should be seeing. As we exit our contact lens area, we walk straight into our large optical where we have hundreds of frames and different styles for men, women, and kids. In the background of this picture, we can see our optical manager's office. And here, please meet Kathy, our optical manager, and also Jess and Jen, who are also trained as opticians. So that concludes the tour of the upper level of our office. We also have a fully remodeled lower level, and we can give you a brief look at that as we go down the steps. We have other offices downstairs as well as a staff break room. And our optical laboratory is also on that lower level, as well as a large conference room that we use for various office and staff meetings. And please meet Brian, who is our practice manager and optical lab manager, and who we keep very, very busy. So, thanks for watching our video. We'll part ways with a shot of our website, on which you can get even more information about our practices.